Hi, I'm Katie Kerr. I'm an assistant professor in the Health Information Management program and the Health Informatics and Information Management department, and I will be providing you with an overview of the professional practice experience and the professional practice experience manual through this lecture and PowerPoint presentation. I will admit that this is a little dry and it's okay to take a break from the presentation and pick it up, at another time. However, there really is no way for me to make it any less dry. It's really an essential component to your PPE, and you will need to know everything that is in this manual. So it is imperative that you do go through this entire lecture and the manual on your own time. And if you have any questions along the way, please don't hesitate to contact me, your instructor, Katie Kerr. So the objectives of this presentation are to familiarize you with the Professional Practice Experience Manual, provide you with an overview of the professional practice experience, the role of the Professional Practice Experience Mentor. It will give you some instructions for while you're on your PPE, the evaluation that your PPE mentor will complete on your performance, and the survey you will complete on your experience, as well as some policies and procedures and additional information that is important for you for while you're on your PPE. So the Professional Practice Experience Manual should be reviewed in its entirety. I can't stress this enough. I have had students in the past get to their PPE, email me a week into it and say, what am I supposed to be doing here? And so I don't want that to happen. And it really is important for you to understand the PPE manual and what's in it. And it is really the primary resource for you and for the professional practice experience and the course and HIM 4555, and you should be referring to it constantly while you're on your PPE. Okay, the manual will guide your experience and provide you with the competencies, objectives, and activities that you must complete while you're at the PPE site. And the manual will be available in Blackboard and will also be mailed to you in a hard copy just prior to going on site. And the manual will also be sent to your PPE mentor, and it contains many items, and we'll review all of them in this presentation. The affiliation professional practice experiences are full-time off-campus learning experiences for the student in the Health Information Management program. The PPE is college-based credit for students paying tuition and completing their baccalaureate degree at the College of St. Scholastica, and there are two distinct elements of the PPE in the HIM program. The first is the virtual directed practice. And the virtual directed practice is taken by students that do not yet have their RHAT credential. And then we have the affiliation component, which is an 80-hour experience. You will be assigned a major project that must be completed while you are at the PPE site. And the project is developed and overseen by the PPE site mentor. You will also select a role or area of interest where you will conduct an in-depth interview with a professional. And this is called the exploration component of the PPE. So while on the affiliation PPE, students are expected to be involved in scheduled activities for approximately an 8-hour day, time shift, Monday through Friday. Other shifts may be included to help the student learn if that is felt to be a desirable learning experience. However, we haven't had that happen in quite a few years. The professional practice experience is an essential component of the total HIM curriculum. PPEs are a way for students to strengthen the academic experience, and it's designed to give students a learning experience that focuses on the structure and workflow of a health information service and or the management of health data services and the many roles filled by HIM professionals that facilitate the collection, use, and protection of health data. Students can be in any place in any organization where data is managed, examined, or used for administrative, financial, or clinical decision making. Students taking part in a PPE are in their 4th year of the baccalaureate program in Health Information Management, and they have a general education foundation plus core foundational courses in the health sciences and computer information systems. In addition, students may have acquired work experience or volunteer experience on their own, and each professional practice supervisor or mentor will receive a student profile prior to the student's arrival on site. So here are some areas that you may observe and or practice in while you're at the PPE site. And we would encourage you to take advantage of any and all opportunities that come your way. But You may experience or observe all HIM department functions. So these may be even functions that you're already familiar with, but we do want you to still see how the department operates and how all the functions are carried out. You may also and should see the supervisory and managerial functions of the health information manager or your PPE site mentor. We want you to experience or observe other HIM roles such as data mining, data analytics, compliance, privacy and security, data quality and integrity, and reimbursement and revenue cycle. And that's just a few. There may be um, many other roles out there that HIM professionals are fulfilling, and we would ask that you just take advantage um, of those opportunities that come your way. The opportunities to meet with those individuals. Other expectations, maybe as relevant to your site, maybe you're visiting other departments that collect, use, or store health information. You hopefully will be able to attend meetings, whether they're administrative, medical staff, or with clients where health information professionals are involved. You will complete a major project while on the affiliation PPE, so that may involve you working with other departments or individuals outside of the HIM department. When we hope that you observe and or interact with medical staff and other organizational employees. Um, if if planning processes come up, we hope that you can participate in those. We want you to provide support work on projects, tasks, or provide some project management functions while you're at the site if they need that or ask for your assistance. And we hope that you also observe and or participate in problem solving sessions, potentially workflow redesign, or looking at ways to do things more efficiently and better. We also hope that you are able to observe HIM professionals, especially RHIAs that are performing various functions within the organization. And lastly, but surely not um, the least, is we hope that you are able to learn about their computerized medical record and the implementation they went through and how they're using it, as well as other software products that they may be using to support the EHR or other HIM functions, such as computer-assisted coding, data mining software, and encoders. So students are expected to cover their own living expenses while they're on their professional practice experience. Some organizations may be able to assist you in locating suitable housing or hotels that you can stay in while you're on your PPE. And I also want to make this very clear and ensure that you don't get taken advantage of, but you really are not supposed to be substituted for paid staff. So if a scanning um, professional calls in sick, you're not there to fill in for that scanning person for the day. Okay. You are really there to just learn operations. It's okay if you spend a couple hours scanning or learning about scanning, but that should not be something that you do all day to substitute for somebody that is called in. And then students are also directly responsible to and under the guidance of the site mentor or manager while on your PPE. And the site manager or PPE mentor may assign a different mentor to help you navigate your PPE. I see this a lot where HIM directors may assign a supervisor or a manager to oversee you while you're on site, and this is very common, so don't be surprised if you may be given a name but then are rerouted to a supervisor or manager under that person that you were initially assigned to. And it's really important that you understand who you are responsible to and the relationships that are required to complete the PPE. So if a mentor is assigned, the student should clarify and be able to identify the go-to person for questions, advice, and assistance. You are also responsible for understanding the learning outcomes and should be closely involved in the planning and targeting of necessary experiences while you're on your PPE. So in other words, if you are given a schedule at the beginning of your PPE and you see that there's several areas that you need to visit but they're not addressed on your calendar or your schedule, then it's your responsibility to seek out those individuals and get their assistance and ask them the interview questions and gain an understanding of their role. All students living in Minnesota or completing their PPE in Minnesota are asked to complete the Minnesota Caregiver Background Check through the Minnesota Department of Health and Human Services. And if you reside in another state outside of Minnesota, you will also complete a background check for your state of residence. If you complete your PPE at an organization outside the state of your residence, so for example, if you are living in Wisconsin and doing your internship or your PPE in Illinois, you would need to complete a Wisconsin background check as well as an Illinois background check. So you need to do one for both the state in which you reside and for the state where the PPE is located. And then we have all students complete a federal criminal background check through the Verify Credentials database. Students are also responsible for assuring that their immunizations are up to date before arriving at the site of their PPE. In addition, the student will have a medical screening as required by the host site, and students will arrange and maintain their own health records in regard to the medical requirements of the site. And in addition, each site may have specific items or elements included in their required health screens, and students are expected to comply with the site's policies and will cover the cost of any health screens or required medical tests yourselves. Okay. So this side covers the evaluations that need to be completed at the conclusion of the PPE experience. So the site manager or mentor must complete an evaluation at the conclusion of your experience, and this evaluation is critical in the grading of the course, HIM 4555. And as a student, it is important for you to understand the importance of the evaluation because your grade depends on it. So the site manager or mentor can use the paper evaluation tool provided in the manual, or and my preference would be for them to use the electronic survey tool that I will provide to them through email. The electronic survey is preferred and recommended. The survey is developed and distributed through a software application called Qualtrics. This evaluation addresses your professional performance, professional knowledge and skills, your interpersonal abilities, attributes, attitudes, and behavior. And the evaluation should be constructively shared with you and provided to the academic coordinator of professional practice experience, which is me, Katie Kerr. This evaluation provides you the opportunity to critically reflect and improve your professional abilities. And I would just really encourage you to ask the mentor to go through the evaluation with you in person before you leave the site, to just kind of talk through it and help you better understand. I will share the evaluation with you either way. However, it is really nice for you to hear the feedback personally from your mentor. And then you, as a student, are required to evaluate each on-site experience and to provide constructive feedback to the site to help improve student experiences for future students. And so this evaluation tool is also necessary for grading, and I will email it to you via your CSS email account. The PPE site mentor is provided a manual prior to the start of your PPE, and they are asked to review the manual and evaluation prior to your arrival on site. This will allow them to understand the goals and objectives for you while you're on site. They should also develop a major project that you can complete while you're on site, and the project should take approximately 20 hours of your time to complete. You need to provide the site mentor with a formal written report of the project and may be asked to present the project to individuals at the organization at a later date. The site mentor should also discuss expectations with those you will be meeting with while you're on site. And lastly, the mentors are asked to develop a schedule for your time at the site. Generally, site mentors do this, but sometimes they don't. If you do not get a schedule from the site mentor, it is your responsibility to identify the job titles and individuals that you need to meet with in order to complete your objectives and student learning activities. This may be an uncomfortable situation for you, but will also be a great learning experience. It's a time when you can really use and apply the skills you've gained while going through the HIM program. And if you're shy and uncomfortable in situations like this, it will be an especially good learning experience and push you to really develop your networking skills and step outside of your comfort zone. We just ask that you use the resources available and ask for a staff directory or contact information in order to obtain the information you need. And we have every confidence in all of you that you will be able to accomplish this task if you are in this position. So the PPE manual is designed to guide both you and your professional practice mentor through your affiliation experiences. You're asked to read it carefully prior to your professional practice experience and refer to it regularly, if not constantly, during each component of your PPE. So the PPE content areas and the student learning activities, which are the yellow section of the PPE manual, when you get a hard copy, you'll see that section, are really designed to assist you in meeting the HIM curriculum competencies. They will guide you on your experience and through the work environment. The content areas within the manual also make reference to being prepared to discuss specific topics. So you will be asked by your site mentor and others to discuss various topics as you proceed through your PPE. And then upon your return from the PPE, you will participate in the senior seminar course and will share your experiences with your classmates. Lastly, you will also share your experiences with your senior seminar instructor in a conference call. At the conclusion of your PPE, every student will complete or develop a professional practice experience report. You must include all of the things listed on this slide in your report. The only exception would be the student evaluations, and I'll talk a little bit about those as we get there. But the first thing that is included in your report is the word process, narrative responses, flow diagrams, tables, whatever the student learning experience is asking of you, student learning activity is asking of you, you'll need to prepare those responses in this written report. Right now we have it set at 12 areas that are required out of all of the student learning activities that you must address in this final written report. We also want to see a word process project report with all the supporting documents and reports of any other tasks or projects assigned to you in this final report. Okay, and there is a document within the PPE manual where you'll see that provides you with a template for this project report. We also want you to include any documentation samples that can be shared and submitted that you maybe find interesting or that might be of benefit to your classmates in terms of learning about your experience in more depth. We also want you to journal at least 2 times each week within the Blackboard course discussion area while you're on site. So during this time, we want you to really just reflect on your time at the site and share those experiences that are unique, that you find interesting, and really the discussion items to consider are laid out in the manual as well. Also, so the student evaluations, they will be sent to you upon the completion of your PPE and to your mentor upon the completion of your PPE. And I am just going to be looking for you to complete the survey, and it will just be factored into your final grade for the course. So it doesn't need to be a formal part of your written report, but I consider it to be kind of a component, okay? The final report must be ready to submit to your instructor for the seminar course, which is HIM 4556. This course commonly follows the affiliation PPE, so if you are doing the PPE this fall, you will take typically seminar in the spring of the year. So the due date for your final PPE report will be determined between the academic coordinator professional practice experience, which is me, and the instructor of the seminar course. Your professional practice experience mentor has been asked to discuss with you on an ongoing basis where you and the mentor are in terms of expectations, needs, and interest. This should really be kept on a regular meeting schedule, and it should also help keep both of you on track in terms of the PPE and making sure that you're getting everything you need. However, if the mentor does not give you feedback, we want you to seek it out. We want you to ask if you're meeting the expectations or if there's anything you could do to improve. Oftentimes, site mentors will wait until the end of the PPE to just kind of spill everything, but if you can seek that out on a continual basis, and throughout the PPE, you'll be able to make improvements and leave a better impression on your site mentor. Your mentor has also been asked to complete an evaluation on you and then forward it to me, the academic coordinator of professional practice experiences. If the site mentor completes a survey on paper, you will have the opportunity to review and sign this evaluation at the PPE site. But if it's completed electronically, the academic coordinator of PPEs, will share a copy of it with you if your mentor has not already done so. So this slide covers some other things that we want you as a student to do. So first of all, we want you to send an introductory email to your PPE site mentor approximately 1 week prior to the start of your PPE. In this email, we'd like you to introduce yourself. We'd like you to clarify the time that you should report on your first day. We also want you to determine where you'll meet the site mentor on the first day. And we want you to seek out information on parking to ensure that you park in an appropriate location. And we also kind of tell students that we want you to report to the affiliation site at 9 a.m. the first morning, unless the site mentor wants you there earlier or other arrangements have been made. So please address this in your email correspondence with the site mentor when you send it. Here are a few more instructions for students. On your first day, when you arrive at the PPE site, we would really like you to just drop us an email and let us know that you've arrived. We just want to make sure everybody shows up and gets there safely and kind of settles in on that first day. We're just kind of anxious to know how you're doing. And you can send that email to me, Katie Kerr, or you can send it to Eric Nordgren, or to both of us, because we would love to hear from you. And also, I really want to explain this clearly, that when you're at the designated site, you are directly responsible to the professional practice mentor. Okay, you need to abide by the protocols of the site concerning break periods, parking, as well as abiding by all the departmental and hospital policies and regulations governing employees. So this is their policy on dress code and cell phone use and all of those internet policies that they may have for employees. And so we just want you to be seen as an employee while you're there, fulfilling the role as of an intern. So these should be discussed with you during your orientation, and we want you to also be sure to acquaint yourself with these guidelines upon your arrival. Any problems or concerns that may arise should be brought to the attention of and discussed with your mentor or site manager. However, the academic coordinator of PPEs is also available, which is me, Katie Kerr, by phone, should you wish to consult with me at any time. It is also really important to wear your CSS identification badge, as well as any identification provided by your host site. The CSS identification badges will be emailed or mailed to you with the hard copy of the PPE manual. While on your PPE, it is also of utmost importance that you maintain professional behavior the entire time you're there. You will learn more about the expectations that the St. Scholastica HIIM department has for you in an upcoming unit of HIM 4555, but for now, I would like to just provide you with some examples of unprofessional behavior that are laid out in the PPE manual. These may seem very obvious to you, but we need to address them. So possession or use of alcoholic beverages or intoxication while at the clinical site, possession or use of a controlled chemical substance except one which has been prescribed by a doctor, voicing unsolicited critical comments about the facility, health information department, or personnel. This is very important. This has happened in the past where students have made negative comments about the facility or their mentor to others, and it has gotten back to them or to me, and it makes for a very uncomfortable situation and could potentially result in the end of your PPE at that site. Also, verbal or physical assault on a facility employee, visitor, or patient, knowledgeable and purposeful violation of a facility or department rule or regulation, violation of the confidentiality of patient information, and violation of the confidentiality of management discussions or employee discussions. So there may be times where you're asked to join in a meeting at the organization, and some of those things that you overhear at those meetings needs to be kept confidential. If you're so lucky as to have a manager or supervisor include you in resolving an employee issue, that is a great honor, but it's also something that should be kept highly confidential and not shared with anybody else. Okay? And of course, violation of professional behavior could result in the immediate termination of your PPE and or a subsequent no pass or a failing grade for this course. This slide lays out some more instructions for your PPEs. First, we want you to make every effort to refrain from being absent. We do understand that emergencies happen, children get sick, things come up, you get sick. And if you have to be absent, be sure that you inform the PPE site mentor or manager prior to your expected arrival. If you do have to be absent, we would like you to check with your mentor or site manager to see if you can make up the time. And within the PPE manual, there is a policy on absences during your PPE, and I would advise you to review this policy upon the completion of this lecture. And if you require medical attention while on your PPE, please inform your mentor or site manager and request assistance in locating an appropriate physician if you need it. You are responsible for payment of any bills rendered for medical service provided to you while you're on your PPE. And you must also have health insurance coverage in effect during your affiliation and then carry an appropriate identification card to present at the time you register for medical services. We also want you to keep in mind that you will be sharing your experience with your classmates during the seminar course and that each student will be giving a presentation on some aspect of the professional practice experience. Experiences that are unique to your site and may not be available to other students in some way are especially important to share. So please keep that in mind as you're going through your experience and make note of this for later use. Bring copies of things that you are able to share, and because we all just are looking forward to hearing about your experience. We also want to advise you that you may be traveling to other sites in the area for tours and meetings while you're on your PPE. These meetings and tours will be arranged for you, but it is your responsibility to get to the appointed place at the appointed time, unless otherwise directed by your mentor or site manager. You should also carry a copy of your health screening and immunization record with you. This is to be given to your mentor or site supervisor upon request. Some sites are asking for copies prior to your arrival on site, but ultimately it is your responsibility to meet this request. So this is actually a joint commission requirement for many of the PPE sites and organizations we utilize. And as I mentioned earlier, state background checks are completed by each student in the HIM program prior to leaving on PPE. And if the PPE is completed in a state outside of your state of residence, a background check for that state will also need to be completed. Background checks are shared with PPE sites upon request, and you are expected to keep a copy with you during the PPE. So in this portion of the PPE manual, you'll find the content areas, guiding questions, and student learning activities of the manual. And in the hard copy of the manual, this section will be the yellow or gold section that you'll receive. And this portion of the manual really contains all the activities that will comprise much of your PPE report and your PPE in general. You will want to familiarize yourself with the content areas, the guiding questions, and the student learning outcomes and activities, as you are ultimately responsible for addressing each area while you're at the PPE site. During your affiliation, you'll want to have this portion of the manual available and ready to reference at all times. You'll want to identify the content areas and student learning activities that must be addressed. And as you meet with individuals within the organization, you will be able to address all of the components laid out in this portion of the manual. It is your responsibility to seek out individuals and the information you need in order to address these components. So if your PPE mentor does not have you scheduled to meet with everyone you need to meet with, then you need to seek out the individuals on your own and use the resources available at your site to contact these individuals, such as using their employee directory. You'll want to take very good notes while you're meeting with these individuals so you have all the information you need when developing a complete professional practice report at the end of your PPE. This slide addresses the competencies included in the affiliation. As an overview, the competencies are broken down into domains, which correlates to our health information management curriculum. and also some subdomains. So we want you to take some time to review this slide and the affiliation competencies and student learning outcomes and activities portion of the manual now to just see how this is all broken out. Let's talk a little bit about the exploration component of the PPE. So what we will be asking you to do is to select a role that you're interested in exploring and want to learn more about with that within the affiliation site. Because there are an increasing number of roles filled by health information professionals outside the acute care health information department. Some of those roles include application analysts, clinical analysts, credential verification specialists, registrars, both cancer and tumor registrars, and trauma registrars, decision support professionals, privacy officers, and compliance specialists. This is just a very short list of a plethora of roles out there and available, maybe that may be available to you at the site in which you're going to for your PPE. And we really want you to select a role that you're interested in and then work with the site mentor to set up an extended amount of time to meet with a professional in that role. So this is something you probably want to identify early on in your PPE because these individuals are busy professionals, and then we want you to conduct an in-depth interview with that professional to better understand their role and explore their profession. You should plan to spend 4 to 8 hours with this professional. The PPE manual provides all of the guidance for your PPE, but there are also 2 policies that you must be aware of. And one is the student absences policy, and the other is the termination of online affiliation PPE experiences and PPE conduct policy. I'm not going to review the student absence policy as much of it was discussed previously in this lecture. However, please take some time to review it so you have an understanding of how the HIIM department will handle excessive absenteeism while you're on your PPE. And then the other policy, the termination of online affiliation PPE experiences and PPE conduct, will be addressed in the next 2 slides. Over the years, the CSS HIIM department has encountered several scenarios involving student conduct. This policy, termination of online affiliation, PPE experience, and PPE conduct, addresses the student conduct that would necessitate the termination of the PPE. This policy can be found in your PPE manual and within the HIM 4555 Blackboard course. As stated earlier on in this lecture, students are expected to conduct themselves in professional manner. You are expected to adhere to all professional standards for behavior and conduct while at the PPE site, and this includes the AHIMA Code of Ethics, the St. Scholastica Student Handbook, the St. Scholastica Policies and Procedures, and the PPE site's Policies and Procedures. You must also comply with the written policies and procedures of the PPE site, the HIIM program at the College of St. Scholastica. And students who fail to comply with these policies and procedures are in jeopardy of being removed from the PPE site, of failing the HIM 4555 PPE course, and of dismissal from the HIM program at the College of St. Scholastica. So according to most PPE agreements, PPE sites reserve the right to dismiss students immediately for violations of professional behavior, policies, and/or a pattern of unprofessional behavior, ethical breaches, unethical behavior, violation of site policies, unsafe behavior, criminal behavior, including but not limited to breaches of confidentiality, theft, billing fraud, and alcohol or drug use. Dismissal of a student from the affiliation PPE site shall be reported immediately to the HIM Academic Coordinator of Professional Practice Experiences at the college by the student. And dismissal from a PPE site for any of the reasons stated previously on this slide will result in an immediate failure of the HIM 4555 PPE course and may include dismissal from the HIM program at the College of St. Scholastica. This slide continues to address the rest of that termination of online PPE policy. It goes on to address that any failure to present to the affiliation PPE site at the arranged time frame, unless there is a verifiable emergency per the HIIM Department Student Absences policy located in the PPE manual, will result in immediate failure of the HIM 4555 PPE course and may include dismissal from the program. The affiliation PPEs will be arranged by the HIIM Academic Coordinator of Professional Practice Experiences, Katie Kerr, or the Program Manager, Eric Nordgren, and the PPE Site Mentor. The dates and times of these PPEs should not be altered by the student. Should you need to change the dates and times of the affiliation PPE, you are to contact the HIIM Academic Coordinator of Professional Practice Experiences or the Program Manager, Eric Nordgren, and they will work with the site mentor to alter the schedule. An affiliation PPE will not take place without a fully executed agreement between the College of St. Scholastica and the PPE facility. If the student completes an affiliation without a fully executed agreement between the college and the PPE facility, the student will immediately fail the HIM 4555 PPE course, and it may result in dismissal from the HIM program. Students should refer to the College of St. Scholastica policies related to probation and dismissal, as well as the appeals process. If you have any questions or concerns about the PPE manual, the guidelines or policies and procedures that I've just reviewed, please don't hesitate to reach out to your HIM 4555 course instructor. They are really here to support you in any way that they can, and we wish you the very best of luck on your PPE.